Hello, everybody. Welcome to the Share Your Story with Policymakers webinar for Breakout America. We're so excited that you guys are all here with us. As you come into the meeting, please go ahead and mute yourself just so we can avoid any background noise as we're going through the webinar. And just giving people one more second to get logged on before we get started. All right, I'm going to go ahead and kick things off again. Thank you for joining us for the Rare Across America Share Your Story with Policymakers webinar. As you know, during this call, we're going to go over how to share your story. You're going to get some tips and tricks from our team and from advocates who have experience with Hill Days previously. So you're going to learn what to expect in your meetings and learn how to prepare for your meetings. You're going to refine your elevator pitch and develop a clear, concise ask for your meetings. You're going to receive tips and coaching from fellow advocates and from every law staff that will help you tell your story with impact and inspire action from your member of Congress. And then lastly, you will practice and receive feedback from our team of coaches. And for that, we are going to break out into small breakout rooms at the end of the webinar. And at that point, you all will practice sharing your stories and receive some feedback from your coaches. All right, so preparing for your meetings. Before your meetings, it's very important that you get to know your legislators. Do some research on them, understand what their role is in your ask. You can see where the bill is, if it's in a committee, if your member is on that committee, if your member is a sponsor or a co-sponsor, all of that is important information. Again, understanding what committees they participate in or lead and what bills they've introduced is important. You may be making an ask that isn't the same, but is similar to something they've done before, and you can tie your ask back to that action. It's also important to understand their platforms and views on the issues that you're targeting or similar issues. So understanding your member's platform and view on healthcare, access to care, rare diseases, all of that is very important information to know going into your meeting. We also encourage you to read and take a look at your members' social media channels, website, or other relevant materials. This is great context on what your members are currently working on, as well as context on the work that they've already done, the wins that they've had. And, we like to encourage you to tie your ask back to that. So say, for example, you're meeting with your member of Congress and they may not do a lot of healthcare related work, but they do a lot of education work. You could tell your rare disease story and talk about how it may have impacted your education and what things would have been helpful for you at that time. And as always, be sure to check out the legislative scorecard on the RDLA website to get better insight into what your legislator has or has not supported previously. The scorecard, we have one per state, and it lists out a variety of bills across the top of the scorecard. And then we'll have the members' names listed down at the other end of the scorecard. And you'll see a check by the items that your member has supported. So definitely check that out, see what your member's been up to or hasn't been up to, and you can frame your conversation around that as well. So as you are preparing for your meetings, it's also important to prepare materials. You want to be sure that you develop your key messages going into the meeting. So that's a little bit of what we're going to work on today, along with the elevator speech. But when you're talking about your key messaging, you can make bullet points for yourself just to refer to during the meeting, things that you are sure you want to talk about, you don't want to miss. So write down some of those bullet points for yourself to refer to as you are preparing for your meeting. And then, of course, your elevator pitch. So that's a little bit about what we're going to talk about today. Ideally, your elevator pitch or your story would be no more than 90 seconds. We like to say between 60 and 90 seconds. So think of it as you're on an elevator with your member of Congress, and you only have from the bottom floor to the floor that you're getting off on to tell them what you want to tell them. So it has to be quick, it has to be concise. You're only going to focus on the most important things. That's what your elevator pitch should be like. Of course, it's always great to take supporting materials with you and concise issue background. And this is where one-pagers come in.
Can I ask a question?
Sure.
I've had what I've had for 47 years. Can you give me like the top 3 things I should talk to my rep about?
Yeah, so it's important.
60 to 90 seconds, and I've got 47 years of experience.
Yeah.
What would be the top 3?
Yes, absolutely. So you want your member to walk away understanding what your experience has been like, what problems you're having, and how they can fix it. So you want to focus on, and we're going to talk about this a little more a few slides down as well, but you want to focus on your experience with your rare disease. What have been the biggest hurdles for you? What could your member do to help you overcome those issues? What pieces of legislation could be passed to solve the problems that you're having? So that's important to focus on. It's also important to talk about the background of your ask. And I'm going to get into a little bit more about the ask here in just a little bit, but it's really important to take in more information about what your ask is, letting them know the background of the bill, the issue that it's fixing. That's all very important information, and that's where the one-pagers come in. If you are using any of the one-pagers or using one of the asks that we're going to talk about in a second, we'll have one-pagers created for you to take into your meeting, so you do not have to create those yourself. However, I will go ahead and stay here because this tends to be a frequently asked question in this webinar. You do not have to use one of the asks that we are going to talk about today. If your story doesn't relate back to one of these asks, that is okay. You are welcome to make another ask as long as it is related to rare diseases. We don't want to dictate what you all can talk about. These are your meetings. This is your time. So definitely feel free to make the ask that ties back to you best. If you do make an ask that isn't one of the suggested asks that we're going to talk about here in a second, we just ask that you create a one-pager on the ask you do select. And we have resources on our website to help walk you through how to create that one-pager. And then, of course, other materials that you want to take in, other information is implications for your community. So if you're making an ask that's related to, let's say, funding, you may want to include if the implications for not receiving that funding or the implications for this ask not being completed, because that is also very powerful. So when you are in these meetings, this is what your legislators expect from you. They expect you to be informative and concise. They take a lot of meetings every day, so we want to be respectful of their time. We're there to give them the most important high-level information that we can, and be concise and compelling in our time with them. We want to go in well-informed. So you all are one step ahead. You're here learning. So you will be good to go, but you want to go in informed, know what you want to talk about, and have a plan. Your legislators expect you to be accessible, credible, and reasonable. And we say reasonable because you have to be reasonable with your ask. If you want to go in and ask your member to get $20 billion for the FDA, it's probably not going to happen. So you have to choose a reasonable ask. It's also important to have a sense of their role, their platforms, and their views. So going back to what I just said, it's important to have a little bit of background information on your member coming into the meeting. They will have background information on you all and what you're there for. When we requested the meeting, we say these are rare disease advocates. from RDLA. They're coming to speak to you about X, Y, and Z. So they have background information on you. You should be prepared and have background information on them. They also expect you to show how the problem applies to them and their constituents. Now, I know this is difficult because rare disease data is really hard to find. So it's really hard to say how many people in your member's district do have a rare disease and how many people are impacted by rare disease. However, you can share statistics about the overall rare disease community, telling them there's more than 10,000 rare diseases. And of those 10,000 rare diseases, 95% do not have an FDA-approved treatment. That is a powerful number, and that absolutely applies to people in their district as well. Also, just want to take 1 second to remind everyone to please mute yourself as you're coming into the meeting, just so we can avoid any background noise here. All right, so what else do your members expect? They expect you to be prepared with your one-pagers. When you are making an ask of them, the one-pager is what you're leaving behind so that they can refer back later and remember what you talked about. So like I said, these members are taking a lot of meetings each day, and oftentimes their staff is taking the meeting for them. So each member of Congress has a staffer who will focus on their health portfolio. And this staffer's job is to inform the member on the things that people are coming in to talk about, inform the member on the things their constituents are asking for. So having that one pager to take back to the member is so, so important. So please be prepared with your one pagers. Also remember that you are the expert on your rare disease and your rare disease experience. Your member of Congress does not expect you to come into the meeting and be a policy expert, but they know you are the expert on your experience. So share your experience with them. Be authentic. There's no need to memorize what you want to say. And if you don't know the answer to a question when you're in a meeting, that is okay. Tell your member that you're not sure, but you will find out the answer and get back to them. Take down an email address and then email us, and we will help get that answer for you and help you get back to them. So we are going to talk a little bit more about message delivery now. One way we like to think of this is talking about the rules of the road. So you are in the driver's seat in these meetings. You are leading the meetings. You are all deciding what topics you're going to speak on, and this is your meeting. It's very important when you're in the meetings to balance fact and emotion. It's, of course, natural to have emotion when talking about the experiences that you have had with your rare disease. But be sure to balance that emotion. We don't want to go in and be overly emotional and sobbing during the meeting. So just be sure to keep your emotions in balance and also facts. So not only sharing what your experience has been like and the emotion of that experience, but sharing facts like the statistics I just shared with you all about 95% of rare diseases not having an FDA treatment. And always remember that less is more. So when you go into the meetings, you do not need to give the member or their staff your full medical history and full medical background. That is not going to inform the decisions they're making. Less is more here. Tell them, this is what my problem is, and this is how you can help. And I'm going to talk to you about that on this slide. This is a really great way to craft your message so that you can take all of those years of your experience, like Greg was saying, and can make it into a 60 to 90 second elevator pitch. So this is the recommended way that we teach, and that is focusing on the problem, the solution, and the ask. And if you have the worksheets that we sent to you all prior, and no worries if you don't, but if you have the worksheets, you'll notice that they are also listed out this way to help you think about what you might want to talk about and to help you craft what you want to say. So you're going to first start with your problem, telling your member of Congress what problem or problems you're having, what the solution to those problems would be, and then ask them to do whatever the solution is. So as you are developing your ask, we encourage you to think about the problem, solution, ask format. And I'm going to quickly turn things over to Bailey McGowan from our policy team, and she is going to walk you all through the recommended legislative asks that I was just talking about. But like I said previously, if your rare disease experience or story does not align with any of these three asks and you would like to make a different ask, that is okay. I encourage you to take down some information, take down some notes on the format we're talking about here with problem, solution, ask, and use that format to create a one-pager on your bill. So Bailey, I will go ahead and turn things over to you.
Cool. Thank you, Caitlin. So hi, everyone. This is our first ask. It is to join the Rare Disease Congressional Caucus. The caucus was started in 2010. We've got members from the House and the Senate. It's really an incredible space for all of our representatives, senators to get together and chat about the issues that constituents are bringing to them specific to rare disease. So it's a really incredible space. Rare diseases cross so many different areas in policy. There's access, there's regulation, so much. It crosses so many different agencies. And there are so many different conditions. Some, all of them to qualify for rare have to affect about less than 200,000 people. Some affect less than 100 people. So this is really an incredible space for them to get together and to, educate one another, to talk to us. We actually held a briefing last week. Our RDLA team did an amazing job helping put that together. We had 6 panelists and we walked away with the message of, the so what, the patient perspective a little bit. And it was a really incredible moment at the end because someone said that, the patients were the so what, the actions and the decisions made in those rooms affect patients and families and their hope for a better future and better outcomes. So it's really an incredible space. You can find out if your member is already a part of the caucus on our website. We've got an incredible link. Thank you, Stephanie. It was incredible. But yeah, so that's a great place to find out if your member is already on the caucus. If they are, please thank them for being a part of it. Again, their role there is so incredible. And if not, encourage them to. It is really a great opportunity to learn more about the space. So that one's pretty easy ask. If we go on to the next one, this is the Help Ensure Lower Patient or the Help Copays Act. Right now we see it's such, patients have such a hard time accessing therapies. There's utilization management practices in place. Like we all face, step therapy, prior authorization issues. And this can be a huge administrative burden on patients that limit their access. We've also seen issues with expensive therapies. And a lot of the times patients turn to third-party sources for this. So sometimes it's charitable donations, sometimes it's manufacturer assistance. Unfortunately, we've seen the practice of copay accumulator programs or copay maximizer programs. They're very similar, which ultimately state that a patient, any payment made on behalf of a patient doesn't count towards their out-of-pocket maximum or their deductible. So patients will go a few months without having to pay for their medications or their therapies, and they get to the pharmacy counter and all of a sudden they've got a massive bill. And a lot of the times they're forced to decide then and there with really no notice, do I go into debt to grab this medication? If I can, do I have to ration it or do I forego it altogether? And that's, as we all know, really not an option for a lot of folks, and it shouldn't be. So what this bill helps to do is to really codify that any payment made on behalf of a patient. So that means those third-party assistance programs, the charitable donations, any payment goes towards the out-of-pocket maximum and their deductible. And it really helps protect patients and give them a lot of relief when it comes to those out-of-pocket costs. I didn't mention the bill number, and I'm trying to remember it right now. give me 1 second on that. But right now, our sponsors are Representative Carter from Georgia, Representative Berrigan from California, Miller Meeks from Iowa, and Representative DeGette from Colorado. In the House, this has 63 co-sponsors. And in the Senate, it's Senator Marshall from Kansas, Senator Markey from Massachusetts, Senator Erst from Iowa again, and Senator Kane from Virginia, and Murkowski from Alaska. So 14 co-sponsors there. What's really unique about this bill this time around, we've talked about it a few times, is that there is a Senate component to it as well. So this is different from last year. Last year, we only had a House bill. So it's a really cool opportunity. This is also an issue you guys might have heard about at the state and the federal level. And so it's really important to advocate for both. And that's why we talk about it at the state and the federal level. The state covers, thank you, Shannon, for putting those bill numbers in the chat. The state level covers really like more individual plans and some smaller employment plans. The federal bill covers those larger employer-sponsored plans, which is what most folks are on these days. So it's really important to advocate at both levels. And I know I went through that really quickly, but I want to make sure that you guys have plenty of time to go through your stories. So the next one we have is our Safe Step Act, which is HR 2630 or Senate Bill 652. With this one, I just mentioned step therapy a little bit. So this is when, a patient will finally get a therapy after maybe finally getting a diagnosis, and then they get up to the pharmacy counter and they find out, hey, your insurance wants you to try this other therapy first. So, okay, you try that therapy first. Sometimes it can be a few months of waiting. Sometimes it can be a couple different therapies before you finally get the chance to take the one that your provider initially prescribed. And as we all know, time is really valuable when it comes to these diagnoses and to living with a lot of rare conditions. And it can delay access to really crucial and effective therapies for patients. And ultimately, it can really, give some distrust to patients and some stress from not being able to, listen to their provider up front and get the therapy that they're probably incredibly qualified to prescribe and diagnose at that time. So this bill would require health plans to establish an exceptions process to step therapy protocols in specific cases. We get this question a lot. It does not ban step therapy protocols in the first place. It just gives a really clear pathway for people who shouldn't have to go through that to be exempt from that pathway. There is a requirement to get an answer within, I believe it's 24 to 72 hours, either way. So whether they approve the exemption or not, and a really clear and transparent reason on why. Again, whether it was approved or not, it's incredibly clear and transparent. And that's really the huge goal of this, is to give patients access to those therapies and to explain what's going on. There's nothing hidden. Everyone is really clear on the process up front. Similarly, this is a bill that crosses state and federal issues as well. So in the same vein, at the federal level, it's really important because it helps affect those larger employer-sponsored plans. And at the state level, it really goes down to the self-insured state level plans. There are so many co-sponsors on this in the House and the Senate. The list is actually like 7 or 8 people long, so I'm not going to read it to everyone. But as of this morning in the Senate, we have 34 co-sponsors. We have 75 co-sponsors in the House. So it's really exciting. I keep saying that, but it's really cool to watch them move forward. This is also a really unique time for the Safe Step Act, because in the Senate, it's been attached to a PBM, or a pharmacy benefit management reform bill, to which I will shamelessly plug the July RDLA webinar that happened this past Thursday for a lot more detailed information on that. But again, this is the furthest this has ever gotten. So it's a really unique time for this, and a really great time to advocate for it, because if that piece of legislation that includes this, so if the Safe Step Act can move forward in the House, there's a really big chance that this will get passed this time around. So it's a really cool time to advocate for, I think, all 3 of these, but really the help copays and the Safe Step Act.
Awesome. Thank you so much, Bailey.
Yeah.
And if anyone has questions on the app, feel free to put those into the Q&A box. And Bailey, if you don't mind keeping an eye on that and answering people's questions, that would be amazing. All right, so we are going to move on to the worksheets and the breakout rooms. So you should have received an email yesterday with 2 worksheets for today. One is an actual worksheet that you fill out. The other more or less has tips listed on it. And both of these worksheets are just a great way to write down everything you may want to say to your member and then edit and choose what is the best thing to say. And this will also help you plan and make sure you're not missing any really important points. So if you did fill those worksheets out, go ahead and pull those out now. If you did not, that is okay. We will make these available along with the recording of this webinar on the Rare Cross America website later today. So you can find the worksheets there if you do not have them now. And I'm going to talk to you guys a little bit about what to expect in the breakout rooms. So these are going to be your coaches for the breakout rooms. Like I said, this is a mix of Every Life staff and really involved, well-educated advocates. So from the Every Life staff, we are joined by Courtney Felly, Amanda Houdshow, Stephanie Reardon, myself, Caitlin Laws, Priscilla Rodriguez, and Lindsay Cundiff. And then our 2 advocates that are joining us today are Kelly Condestein and Kendall Rupp. So huge shout out to all of our coaches for taking the time to join us today. You will be in a breakout room with one of these friendly faces. And of course, if you have any questions today, feel free to ask your coach in your breakout room. They are there to support you and give you feedback. And as we go out into these breakout rooms, be sure again to have those worksheets and the flyers on hand with you. Also, any one-pagers you're interested in using. This says coming soon because we have one one-pager that's not quite ready to be on the website yet, but the other 2 one-pagers, Caucus one-pager and the Help Co-Pays Act one-pager, are both on the website. The Safe Step Act one-pager will be on there soon, so keep an eye out for that one. So you are going to be automatically placed in a breakout room. Be sure to click join to enter the breakout room in just 1 second whenever you are prompted. If you're interested in sharing your story in your group to receive feedback from your coach, please let your coach know. Whenever you get into the breakout room, in the chat window, go ahead and include your name, where you're located, and your rare disease affiliation, if you're comfortable sharing that. And this will just give your coach an idea of who's in the room with them, and will also give you an opportunity to see if there's other advocates in your breakout room that are close to you. And then following the breakout session, we will all come back into this main room together. We will have our coaches share some key takeaways from their rooms that they think would be helpful for everyone else to hear. And we will close out. So Shannon is working on our breakout rooms for us now. So I'm going to give Shannon a second to make sure that those are good to go. And just want to reiterate that these breakout rooms are a time to share your story, to get feedback from your fellow advocates, from your coaches. So please don't be shy. We want to be here to help you guys. So please share with your coaches, allow them to give you some feedback. This is really valuable time.
Caitlin, the breakout rooms are ready. Would you like me to go ahead and open them?
Perfect.
All right. Thanks, everyone. So, how long, Caitlin, would you like them open for?
So we are going to come back to the main room, let's say 10 minutes till 3.
Okay,
So we'll be in these for 20 minutes.
Great. All right. I will open them now.
Awesome. Thank you, Shannon. Hello, everybody. I'm going to give everyone just a second to get logged back in from their breakout room, and we will go over a few key takeaways. Looks like everybody is still coming over. I see a few coaches in here, but any coach like to volunteer to share some key takeaways first?
My advocates did a fantastic job. We're in the 60 to 90 range. Told them to be confident, but one key takeaway that I took from just being in my meeting, this is something new for me as well, but Shauna, next to her name, she has her location and her rare disease, and oftentimes individuals mispronounce your rare disease. So it was nice to hear her say the disease and see the spelling, and it was completely different. So word of advice, if you feel comfortable sharing your name, location, and your disease, it really makes an impact.
False rep.
Thank you, Priscilla.
My group also was amazing. They have amazing testimonies. I think they're going to make such a big difference, and I'm glad that we have their voice now to advocate with us. I think two big takeaways is, instead of asking, do you have any questions at the end, which is just a yes, no, and lots of times people are tempted to just shut it down with a no. If you flip that on its head and ask, what questions do you have, and leave it open-ended, it tends to promote a lot more conversation. And my team has found that we get a lot more done that way. And then my last takeaway would be, when you're handing in your one-pagers, a lot of it is just black and white text, and they have hundreds of those papers on their desk. So if you make a one-pager about yourself where you put your ask at the top and highlight it in yellow, scientifically, yellow is the color that we see first. So they're going to be drawn to that. And at the bottom, show your picture, maybe put a little zebra ribbon on there. Just try and personalize the story so that they get a little glimpse of that and it triggers their memory.
Those are all great. Thank you, Kendall.
I'll share for our group next. We had a lot of really helpful insight and valuable conversations. One of the first suggestions was practicing your pitch while sitting down, that a lot of us are used to public speaking while standing up and giving presentations, but if you're meeting virtually, you'll be sitting down, and a lot of people aren't used to that. So that was a good one. Another one said, don't always put a neat bow on it, which meant when you are telling your story, it's okay to put some of your emotion on it, because when your legislator is hearing your story and hearing that impact that it has on you, they are going to want to say, well, how can I make it better, and put that impact. And I know, Caitlin, you did a great job saying, keep composure of your emotions. So make sure you balance all of that. But it's okay to really not necessarily read off of a script. And then the last thing that somebody made that was really powerful, we were talking about step therapy, and somebody said, when you get a diagnosis, that means you have knowledge. And because of knowledge, you have power. As with step therapy, it kind of pulls away that knowledge and power from you. And you feel like you're kind of just playing a game of when am I going to get my power back? So I thought that was a really good idiom and a good way to explain what step therapy is like for a patient.
Thank you, Stephanie.
We had some good advice in our group as well. One of our members actually suggested that you practice your speech, turn on Zoom so you see yourself in the camera and you're looking at yourself. You can practice it right in front of your computer like you would the day of. And again, time yourself and practice it as many times as you can. So it's basically kind of just like a muscle memory type thing when it comes time for that day. And also to one of the members of our group brought up durable medical equipment and how things are changing it was Nevada. And so I suggested seeing if there's any tie-in to the Copay Accumulator Act. So to make ties to other acts that are already on the table when possible.
Awesome. Thank you, Kelly.
I could jump in. I feel like the theme of all of this is that everyone's groups had like such fantastic ideas and pitches for how meetings go. Mine was not the exception. Everyone in my meeting was fantastic. And I would say our biggest takeaway was also about connecting your ask to what's happening in your state or to what you know your legislator is interested in. Having a little bit of that knowledge to think about it as building a relationship and figuring out what you can also offer that your legislator cares about when you're figuring out how to frame what you're asking for. And as always, talking about your lived experience and your story is so crucial here.
Thank you, Courtney.
I love that. Because these stories are the so what of the policy asks. Like what your asks are like, that's what's on paper, that's the fix, but you guys are the so what. You guys are what matters and what's really going to sort of stick in their brain when they hear copay accumulator. The facts might not, but they'll remember that one person who came and talked to them and told them this incredibly personal story.
We also had a member of our group, that's a little bit afraid to share their story and share their ask and stuff. And, I did Rare Across America once and then Rare Disease Week twice. And I said, whether it was the legislators themselves or the legislative aides, they're all very sincere. They sit and listen. They do have follow-up questions oftentimes. One of the legislators had tears in her eyes after I shared my story. And so they are very compassionate and caring, and there's no reason to get intimidated by it because they want to help and they want to step in where they can.
Thank you for that, Kelly. That's a great point. Awesome. Well, do any other coaches have takeaways they want to share?
Yeah, I can share that one thing that we discussed is what to do when this isn't your first meeting with this legislator and say you've already asked them to join the caucus and they haven't yet. So how do you approach that? And so we kind of discussed, if you're feeling comfortable being a little bit more direct and asking them if they have some specific reasons that's holding them back from joining the caucus. To kind of make that different, because we have an advocate who will be meeting with this legislator for the third time, and they still haven't joined the caucus yet. So seeing what that's all about.
Yes, definitely following up on the ask you've made before. It's completely appropriate, especially if your member hasn't done the thing that you asked before. Just following up to ask why. If you have, if they have any questions that you could answer about the ask. That's a great tip. Thank you, Amanda. Awesome. I'm gonna go ahead and close out with just a few more tips about practicing. I know Kelly mentioned Zoom, but a few other options are to use your phone to record your elevator speech and then play it back and listen to what you said. Think about how it felt, how it came across. Was it brief? Did you speak clearly? All of those things. As I'm getting ready to read the line, don't use words like that's as I said it. That's just a habit that I have, so I would never be able to turn that off for meetings. But if you could work on it, then you could. And then, of course, including your call to action is so important. Sharing your story is key in these meetings, and then following up with a call to action after sharing your story. We always want to make sure to do that. And then you can take notes for yourself and practice again. You can practice in the mirror, practice on Zoom. There's plenty of options. And then, of course, if you have any questions as you are practicing or working on your elevator pitch, feel free to reach out to our team. I'm going to drop my email in the chat for everyone. Feel free to reach out to me. If your availability for your meetings has changed and you need to update that, you can email me to update your availability. You should all receive your meeting schedules by Friday this week. If you do not receive an email with your schedule by Friday, please reach out to me and I'll make sure that it gets sent to you. And thank you all for being here today, taking the time to come learn more and to practice with us. We really appreciate it. And we look forward to seeing you in Rare Across America meetings.